All right, guys. So for the next baby complication, we should be looking at the concept of gastroschisis. All right, gastroschisis. So for this concept of gastroschisis, you just have to do it. The baby's intestines are out. Now I want you also to briefly spot out the differences between gastroschisis and what omphalocele. So for omphalocele, the intestines are still covered by a membrane, but for gastroschisis, there's no membrane covering it. So it's just a serious condition. This is where the baby is born with intestines, and sometimes other organs, they are protruding outside beside the belly button without any protective covering. So it's a type of abdominal wall defect that develops early in pregnancy. So what causes this gastroschisis? The exact cause is not known, but several factors may contribute. Like the mother is very young, right? The mother is smoking, abusing alcohol, using drugs during pregnancy, right? The mother has a low body mass index. Maybe it's genetic, all right, environmental influences. So for next, what we have is it's usually dictated during routine prenatal screening. Right, ultrasound shows exposed intestines floating in amniotic fluid. Do you understand? So the intestines are exposed; they are floating out. High alpha-fetoprotein levels in maternal protein blood. The MRI or fetal echocardiogram just to assess the severity. So for complications, of course, if you leave the intestines outside, it might result into things that like inflammation and swelling. They can twist, that's volvulus or atresia, feeding difficulties, right, nutrient absorption issues, then infection. All right, so what's the treatment? So primary repair, that's a surgical. So surgical treatment is basically the main thing, because you are dealing with an anatomical defect. Staged repair, this one is depending on the amount of organs that are outside, and such a baby should be put in a neonatal intensive care unit.